Today, our guest is Dr. Shalini K.A. Dr. Shalini has made various presentations in this forum, and she has made beautiful presentations. All the presentations were very, very excellent. She has completed her BHMS and she had graduation from Government Homeopathic Medical College, Bangalore. She had a certificate course in children health and certificate course in gynecology and obstetrics. She has a certificate course in skin and venereal diseases from BIMT, Pune, Maharashtra. She, as a physician, she is a duty doctor at the Homeopathic Charity Center, Bangalore, since 2009 to 2015. Then to Nizara Clinic, Bangalore, Karnataka, from 2015 onwards. Now that is run by herself, and she has a very good very good number of patients with her, and she is a very well-known doctor among the public in the area. And today she will be discussing about malaria and its homeopathic treatment. As you all know that we just celebrated the World Malaria Day on 25th April. And anyway, let us welcome our Dr. Shalini to this session. She had made excellent presentations in the past. All presentations were connected to somehow with some celebrations. So welcome, Doctor, to this session. Sorry for the mistake. Yes, you can unmute, Doctor. You are co-host. Please unmute. Yes.
Yeah. So thank you so much for this opportunity for me to present today. It's regarding World Malaria Day celebration, which we celebrated on April 25th. So I'll be speaking about malaria and its homeopathic treatment. So I'll be sharing the slides. Okay. As we all know that on April 25th, we celebrated World Malaria Day. Malaria is a very important topic. Like in the villages and in cities also, and in slums and in HRA sites, we get lots of malaria cases. So malaria cases means the characteristic symptoms is the fever with chills. There is the evening rise of fever with chills. So in any primary health center, any fever case comes means they will do blood smear test, like to find out whether the patient has malaria or not. So malaria is a very important topic. As we all know, like malaria is caused by the mosquito bite, that is by female Anopheles mosquito. So as you all know, like the mosquito life cycle is there. So these mosquitoes, that is the female mosquitoes, it needs humans' blood as a protein for its reproduction. So when the male and female mosquito mate each other, and for its reproduction, it will lay eggs on the freshwater surface. So in it's not only that malaria is caused in winter season, rainy season, or monsoon season. In summer also, we get lots of malaria cases. For example, in rainy season, when it rains, so in the outside or in the surroundings of our house, there is water stagnation. So these mosquitoes want fresh stagnant water to lay eggs. So it will lay eggs on the surface of the water. So these eggs hatch in 8 to 10 days. It will take to hatch into larva. So there are 4 stages in the mosquito life cycle. That is the egg, larva, pupa, and adult. So when the eggs are laid on the surface of the water, it will take some 8 to 10 days to hatch into larva. So larva, it will take some 5 to 7 days to hatch into pupa. So after the pupa, it takes some 8 to 10 days to develop into adult. adult mosquitoes. So these mosquitoes lay egg on the fresh water for its reproduction, as I have already told. So when a person has a malaria, for example, so the person becomes a host. So this mosquito wants blood from the humans for its reproduction. So it will go and bite the malaria patient, and it will suck the blood and it will keep inside. So then again it will go and bite a normal person. So malaria is caused from a mosquito. So this is the life cycle which goes on. I think you all understood. So when a female Anopheles mosquito bites a person who has malaria, okay, then that blood is stored inside the mosquito. Okay, then this mosquito goes and bite the another healthy person. So malaria is spread from uh, from the mosquito bite. So this is the life cycle which goes on. So the characteristic symptoms of malaria is, as I have already told, there will be headache.
Okay.
So
Doctor, there is some problem with my mail, so it is not. I am not able to share. So you can continue the presentation.
okay, sir. Okay. Um, so the characteristic symptoms of malaria is fever with chills. There is the evening rise of fever, febrile, and there will be headache, there will be malaise, there will be vomiting, there will be diarrhea also, and there may be loose motion and rashes, fever with rashes on skin also. So these are characteristic symptoms. The primary characteristic symptom of the malaria is fever with chills. So any patient who comes to any primary health center for the fever complaint, so the lab technician does the smear test, that is the malaria smear test, to find out whether the fever is of malaria or dengue or typhoid or viral fever. So that's very important. So when any patient comes to us with this malarial symptoms, so we should find out what kind of fever it is. So we need to do the blood smear test. For the malaria, we do blood smear test. Then we do RDT test. That is in the cards. They do the test, which we get the results in 15 to 20 minutes, and we do PCR test, CBC test is also done, urine routine test is also done. So uh, uh, these are the malarial tests we do. So so this malaria, these are the characteristic symptoms. When any patient who doesn't take care of himself and like any fever case means if he takes any, if he ignores his symptoms, then it may cause many complications in the body. Like it can damage the spleen also, damage to the liver also. So the RBC is affected more in this malaria, and it may lead to bleeding disorder also. It may cause nasal bleeding, nose bleeding, or the gums bleeding also is seen, and the patient develops myalgia, that is the muscle pain, joints pain, bone pain is also seen, and there is pain behind the eyes also, orbital pain is seen. So body muscle pain is seen main, and like arthritis kind of pain is seen in the malarial patients. So these are the characteristic symptoms. So in CBC count, like in the complications, it may lead to the decrease in the RBC counts also, and RBC count, erythrocytes count is decreased, and it may lead to bleeding disorder also, and the patient develops hypotension symptoms, like the BP is reduced from the normal, and it may lead to the many damages in the body, like as I have already told, spleen, it may affect the spleen, it may affect the liver also, it will affect the kidneys also in the complications of malaria, and it may lead to death also. So malaria is very important topic in the primary health care center. Malaria is treated as a separate like a department to find out the malarial cases. So in many slums and in many apartments, we see like there will be stagnation of water in the flower pots. So as I have already told that malaria, it depends on the fresh water stagnation. So where and all we find the water stagnation means like outside the house means open sumps or open drums, unused drums or water cans, any flower pots in that water stagnation will be there. Inside the house means in the refrigerator behind the box, like if water stagnation is there, and in air conditioners, air coolers, if water stagnation is there, or any unused cycle tires or vehicle tires in the terrace, or any unused drums, buckets, mugs, water will be stagnated, they will not use. So in these water the mosquitoes breed. So we have to give awareness to others, and we should know like how the malaria is caused. It is mainly due to the mosquito bite. So mosquito breeds in this water sources. So we have to find out, and we have to keep our surroundings clean. And by the time of evening, we have to close the windows, we have to lock the windows, doors, and all. We have to use mosquito repellents. We have to use meshes, uh, like repellents, like many we get in the shops, like all out we get. So mosquito repellents, mosquito coils we need to use to prevent ourselves from malaria or dengue cases. So these are the preventive measures. So as I have already told, the causative factors is the like outside surroundings and all. We have to keep the surroundings clean. And if any garbage, open garbage is there, and open garbage, so we have to clean it. We have to keep our surroundings clean. So these are the causative factors, and these are the preventive factors, and the signs and symptoms also I have already told. And we have to use full sleeves clothes so that the mosquitoes doesn't bite us. Full sleeves pants and full sleeves tops or the shirts we have to use. And in the evening time in some grounds and all, there will be so many mosquitoes. So we should not allow any children, or we should not go there in the evening time, so that the mosquitoes will be more in the meshy areas. So these are the things we have to keep in mind, so that we can prevent from malaria. So as I have already told, in the complications, it will reduce the RBC counts, and the platelet count is also decreased. For example, the normal count of platelet is 1.5 to 4 lakhs. And if the platelet count decreases to 60,000, 80,000, or 70,000, and the patient may go to the unconscious stage, like coma, um, and his BP may reduce, and there will be nasal bleeding, and brain hemorrhage also it can cause. So these are the complications, and it may lead to death, as I have already told. So there are different types of malaria, like falciparum malaria, vivax, ovum. So these are the types of malaria which we see in some tropical regions. So most commonly we see malaria falciparum cases only. So these are the important things. The female Anopheles mosquito. Why female mosquitoes only bite Anopheles mosquito means for the reproduction it needs humans blood. So these are the things. So I have told about the malaria. As we all know that homeopathy was born from a beautiful remedy called cinchona bark. As we all know that Samuel Hahnemann, he was doing many experiments. But one characteristic, like for the malaria, when he was doing experiments and when he was finding out the remedies, he found out that the malarial symptoms was seen in cinchona bark. So he took many allopathic medicines also, many metallic medicines also, but it was not curing malaria. So Samuel Hahnemann, when he got striked in his mind, like, let me try out with cinchona bark. So one person was having the symptoms of malaria, and he gave that cinchona bark one dose to him. So as a miracle, it cured. So he thought, okay, let me myself only take this cinchona bark one dose and let me see how it will work. As we all know that homeopathy is like cures like. So he was healthy. Samuel Hahnemann was healthy, and he took cinchona bark one dose, and he developed the symptoms of malaria, the characteristic symptoms of malaria, that is fever with chills, headache, myalgia, vomiting like diarrhea, and fever with rashes. The symptoms he developed. Then that one experiment it gave birth to homeopathy. So that cinchona bark, China. So that is one dose when he was normal, and when he took that one dose of cinchona bark, he developed the symptoms of malaria. So as a blessing or as a boon to us, homeopathy was born. So the cinchona bark remedy is very beautiful remedy, and it's a very important remedy. Even I have tried in my practice also. The characteristic symptoms which in the book is given when we get a patient with the characteristic individual characteristic symptoms, when we give cinchona bark, it will cure the patient completely. In my clinical practice, one patient, he was aged some 42 years, and he had the symptoms. So I took the case and all, and like it matched cinchona bark only, the malarial case only. Some 6 months back I got this case, and the characteristic symptoms of cinchona bark was matching to him. Like the fever with chills, that evening rise of temperature. So I thought, okay, let me just try out. So first, he was taking allopathic medicine. Then the first remedy which I gave was Naxomica, and after 15 days, like it was he was feeling better. Then that sorry first I gave cinchona bark after taking the case, and after 15 days, like when everything his symptoms were reduced, and he was feeling better. And after that, I gave sac to him. So we have to take the case properly, and we have to find out the totality of symptoms, the characteristic individual symptoms we have to find out. So when we find out only, we can treat the patient properly. So cinchona bark is a very important malarial remedy which Samuel Hahnemann has experimented, and he has given a beautiful remedy in the homeopathy. So the other remedies for malaria or the main is China, and we get eupatorium also. It's a very important remedy. The symptoms are like a fever with chills, but there will be joints pain more in that. So joint pains, and we have to take the case like aggravating symptoms, ameliorating symptoms, and miasmatic. According to that, when we give the individual characteristic remedy, eupatorium also will help very good in the patient. And we get many other remedies like nature also. Uh, the symptoms will be there, but when the desire for salts comes, nature mule will work like very beautifully. And in one of my case, one female had come. She is something around 19 years old, and she had the symptoms of this fever with chills, and she had headache. The headache was aggravating in the morning 9 to 11, something around 9:30, 10 to 11. So and she had a desire for salts, and her mental sphere was she wants to be alone. She likes to be alone. Desire for salts. aversion to sweets was there, and she was lean and thin. There was oily skin, acne was there, fever with chills, headache was there. Headache, the characteristic is from in the morning it used to get aggravated, and when she goes in the sunlight, um, she used to get headache more. So I tried out Natramure and it worked very well. So these are the characteristic symptoms. So when any patient comes to us, we need to speak to them properly. We have to take them into confidence. When they get confidence in us, like yeah, they may help me to in helping me to get rid of these symptoms. Then they open up slowly. So we have to slowly develop a friendship or bond with them so that they open up and they tell the characteristic symptom or the individual symptoms, like she likes salt more, she doesn't like sweets, and the headache is aggravated in the morning, something around 9:30 to 10. So these we have to extract from them. So Natramure also will work very beautifully, and the other remedies we find many for the like, as I have already told, Cinchona Equatorium, Natramure. It will work very nicely, and since it's very since it is a very important since it is a very important remedy, Natramure. Other than other other remedies which we find, uh, is I'm audible? Hello? Hello? Is I'm audible?
Yes. You are audible. Audible.
Yeah. Okay. The
And
other, yeah. The other remedy is arsenic album. Arsenic album also is a very important remedy, because all complaints are aggravated after they're after aggravated in the night time, and the patient is highly restlessness is there with high fever with chills. So arsenic album will is a very good remedy. The characteristic symptom is the patient is the highly restlessness is there with fever with chills. And another very important remedy is ferrum phosphoricum. Okay, and this patient is marked with the weakness and prostration with the fever with chills will be there. And the another remedy is Naxomica. In Naxomica, the patient complains of fever with chillness and shivering is there, and the fingernails are in bluish color. Okay, and he want even though it is fever with chills, he doesn't want to cover up. So that is the very important remedy in Naxomica. Okay, as I have already told, and another very important remedy in the females is pulsatilla. It is a very effective remedy in malaria. That fever with chills will be there, and there will be body pain, and she cries for small things. She cries for small things. So we have to find out that characteristic individual remedy. So pulsatile also will work very beautifully in this fever with chills case. Um, so, as a citizen or as a homeopathic physician or any student, we should know about this malaria as it is very important, and we have to give importance to it, and we have to spread awareness regarding malaria. So we need to know what is malaria, what are the signs and symptoms, how it is caused, and what are the remedies. So that if we give awareness program in schools, in government schools or colleges or in slums or in HRA sites or in apartments, so the people may get the awareness about malaria. And when we come to know like how malaria is caused and what are the complications and what are the precautionary measures, as I have already told, so that we can prevent the malaria. So we have to the one slogan or one proverb is there. Prevention is better than cure. So we have to prevent malaria. So as I have already told, how we can prevent malaria means we have to keep our surroundings clean. Any water stagnation is there, then we have to outsource it. Like any unused drums are there, or any unused cans, water cans are there, we have to we have to throw it out. Any cycle tires are there, inside water stagnation is there, then we have to throw it. We have to keep our surroundings clean. Any garbages is there, we have to clean it properly. Inside our kitchen also, if any unknowingly, if we have kept any water in the vessels and in the upstairs and all, we have to clean it, and we have to keep our surroundings clean so that the mosquitoes doesn't breed in this water stagnation. So we have to lead our healthy life. So when any case in our house or in outside or in our clinical practice, any fever case, we have to give awareness or advice to patient. Like any fever case in 2 days, if it doesn't subside, then they have to go for a blood test to rule out malaria, typhoid, dengue, chikungunya, or what kind of fever it is. So we have to advise any patient or our relations or any friends to, like, we should not ignore any fever case. So fever is the characteristic symptom. So we have to advise them to go for a blood test to find out whether it is malaria or dengue or typhoid or viral fever, so that we can save one life. If it goes to complications, it may lead to death also. So this is about malaria and its homeopathic treatment. Uh, yes, sir. Hello?
Yes,
Doc.
Yeah.
yes. Those who want to participate in the discussion can raise the hand and you can participate in the discussion. Doctor, can you explain how will you treat the malaria and viral disease, the so-called chikungunya-like diseases? How will you differentiate all those things even without diagnosis?
Okay. In the symptoms of malaria is fever with chills, headache, vomiting, as I've already told. Myalgia will be there. In chikungunya, there will be no chills. Fever with joints pain will be there. So fever with chills will not be there in the chikungunya. Fever with joints pain will be there. So, so this is the characteristic symptom without blood test or any laboratory test. So to differentiate between malaria means fever with shivering chills will be there in malaria. In chikungunya, there will be fever with joints pain. So this is the characteristic symptom. But we have to go for blood test, laboratory test to rule out what kind of fever case it is.
Yes, doctor. What kind of percentage you get the malaria cases in your area?
In my area, not many malaria cases I get, but I go to another place for practice also, where there is more of this HRA sites kind. So like we get 1 or 2 case in 15 days, 1 or 2 case.
Then what are the potency you used to choose in malaria cases?
Sir, I choose depending on the case, I choose 200 one dose, 200 potency one dose.
Yes, thank you. And really a very good session. And unfortunately, we were not able to upload the PPT since my phone mail was full of mails and I could not download it in my desktop. That's the reason why I couldn't share. Anyway, next time we will try. We can directly post it before the session itself, so that we can upload and you can go ahead with the PPT. Anyway, even without PPT, you managed to explain about the problems of these signs and symptoms, as well as how one can differentiate the medicines used for this malaria treatment and everything. It's a very nice session. I think some of our doctors can also make a comment on that, as well as they can share their experience. I think Dr. Ram Paresh sir is there. Sir, you can, you can be a co-host so that you can come out open your video and you can share your thoughts, sir. Ram Paresh sir. Now you are co-host. Harian sir. As we all know that China, doctor has explained how China was discovered in for the treatment of malaria and how homeopathy was discovered by Dr. Samuel Hahnemann. These are some of the points that everybody know, but what is the relevance of celebrating this malaria? That's what I would like to ask to Dr. Shalini. Why is malaria being celebrated on April 25th? Do you know?
So for me,
Yes, yes.
sir, yeah. It's in the World WHO organization. It has been on April 25th only, the World Malaria Day is celebrated. The WHO has given guidelines. Sir, I would like to share about the Cinchona experiment, which I
Yes.
wanted to
Yes,
share.
yes, definitely. You can share.
Yeah. So the homeopathy was born at time when the practice of other medicine was in its it was in its more infancy and largely accepted. Those who had the misfortune to fall into this taking the highly toxicated antipathy treatment. So it was like Samuel Hahnemann, the founder of homeopathy, began his study of medicine. On graduating from the University of Germany, he set up practice as a medical doctor. So his writings from this period show that he was soon to the antipathy treatment, he was unhappy. So it was causing many harm to the patient. So unable to relieve the sufferings of his own children also. So Hahnemann stepped away from this antipathy treatment and he developed into this homeopathic treatment. The Cinchona experiment started while he was about Cinchona bark, from which the thing quinine is derived. Hahnemann conducted an experiment that was to change the course of his life and the future of many others to this. He argued that Cinchona was effective in the treatment of malaria because it was bitter and astringent. Hahnemann knew that other herbs with the same properties did not help malaria. So why Cinchona bark was effective when others weren't? He was thinking. So in an experiment that homeopathy entry into this world, Hahnemann decided to test the Cinchona bark to himself. After taking the first dose, he fell ill for a period with symptoms similar to those of malaria fever. That is, the symptoms were like with fever, there was thirst, there was drowsiness, there was anxiety, muscle pain, joint pain, and there was um, muscle pain, anxiety, and joint pain. So he repeated the dose, and each time the same thing happened. Hahnemann wondered from this experiment if cinchona bark eased the symptoms of malaria, not because it was bitter and astringent, but because it could produce malaria-like symptoms in healthy people. He was to test this hypothesis on himself, family, and other family volunteers in the uh, and each time he gave the same symptoms developed in the healthy patients. So this took the birth of homeopathy. 6 years after that first Syncona experiment, Hahnemann felt he had enough evidence to release his findings to the scientific and medical community of the day. In a landmark essay titled A New Principle for Ascertaining the Curative Power of Drugs, he explained the new phenomenon he had been witnessing and provided numerous examples and histories. The concept of like cures like, noted since the time of Hippocrates, had finally been validated. The year was 1796, and to this day it considered the birth of homeopathy. China is the name of homeopathic medicine used in the first experiment by Samuel Hahnemann, originally known as cinchona or the Peruvian bark. It is now known in homeopathy by its Latin name of China officinalis. The physical symptoms that Hahnemann experienced after taking a dose of China were he developed cold feet and fingertips uh, were cold, and he developed drowsiness, and he had intolerable anxiety, and there was weakness, and there was trembling, and there was heart palpitation was seen, and there was a quick hard pulse rate was raised, and he developed unpleasant sensation in the bones, that is the bony pain, rigidity of joints, and there was headache was seen, redness of cheeks, fever, and thirst. These symptoms were similar to those experienced by malaria sufferers, and in homeopathy act as a guide to symptoms China will treat. He repeated this test of taking China by Hahnemann by other volunteers since he has shown this symptoms, and the same symptoms um, he saw in other volunteers who took the Syncona bark one dose. So with this clinical use, homeopaths have further observed that mental emotional symptoms also accompany China's physical symptoms, and that one or more of the following may be present, like irritability, easy offensive or paranoia, that is the mood swings, and uh, as and falling asleep, which then in the morning appear. Anxiety was seen, the fever, chills, and anxiety, weakness, muscle pain was seen. So it is this one remedy which helped Hahnemann or the to the world for the birth of homeopathy.
Yes, a beautiful narration of the birth of homeopathy. That's what you did in a short answer. And now it's up to Dr. Ram Paresh to say your experience with this China, as well as what is the situation in your place, whether this malaria is quite prevalent nowadays or not.
Thank you, Dr. Dhanesh. Congratulations, Dr. Shalini Madam. Very thanks, Dr. Shalini Madam. China is a first remedy in homeopathy. Other name of China is homeopathic science. Beginning, China is homeopathic science. China is a good remedy. for malaria treatment and theory of homeopathy, bringing China, Similia Symbios Purencher, very good remedy. China is all weakness, fertility delay, other symptoms, similar like symptoms, China. Very thanks. Dynamic lecture, Dr. Shalini.
Thank you, sir.
Thank you.
Thank you.
Hariharan sir is there or not? I think so. He left. Doctor, what kind of diseases you used to treat in your location, and whether it is acute diseases or chronic disease, which is more prevalent in your area, or and you are not of that?
Sir, I get all kind of cases like acute and chronic. Like I get more of hypertensive cases and like more of acute cases are less, but more of chronic cases I get more like hypertension or diabetic or hypothyroidism. Such kind of cases I get more. Acute means yeah, I get more of this kind of fever, cold cough, this kind of cases.
What kind of government support for homeopathy in your place?
Yeah, here it's very good, sir. Like we have homeopathy government college, medical college, and the hospital is there in Bangalore, and there we get lots of cases, and I have studied there only. And we get all kinds of cases like that, female, children cases, and all kind of cases we get there, and there will be more cases, and there will be more of rush kind of in the morning times.
You're practicing the Bangalore city itself or somewhere else?
Yes, sir, in Bangalore city only, in Mahalakshmi Layout.
Okay. Then what is the number of patients other doctors getting? Whether it is very high number of patients are there for homeopathy or only chronic people disease?
Yeah, sir, other doctors also and myself also, we get moderate kind of cases, and they are finding benefits as we have to take the case properly and we have to give the remedy. So the inflow is normal, like we get moderate kind of cases.
Okay, what kind of support you get from your organizations?
Yeah, they support a lot, sir. Actually, like on April 25th, like I did a World Malaria Day celebration in government schools and in slums. Like they support a lot. And we give, like on this occasion, we gave free medicines also to the children. Like they support a lot, and they like this homeopathic medicine and its treatment because it has less side effects, and it's very minimal and simple medicine. So
Okay.
they support us.
Yes, all kind of people are visiting homeopathy, or only high class or low class, or what kind, or all kind of people.
Sir, all kind of people, sir, all kind of people,
Yeah,
all
okay.
classes of people.
Yes, whether you are getting referrals from other side, the allopathic.
Yeah. So many cases they refer to us. Like for example, psychiatric cases, they will be taking allopathic medicine, and there only doctors have referred to take homeopathic medicine as it will help in the mental sphere. Like I got 2 cases referral for the psychiatric cases.
Okay, that means a very good rapport between homeopathy as well as allopathy doctors there.
Yes, sir.
Yes, that's a good thing. That's a good thing.
Yes.
Things are entirely different here. That's why, but only things are not 100% wrong, but some part, nearly 20% of doctors support us. But 75% majority are not supporting. and they thought they are telling that these are placebos and there is no use of this taking this thing. But when they verify these things with their patient, then they will feel that, oh, what I said was wrong, like that. What kind of hope you are expecting for homeopathy in your places?
Sir, hope and scope is very good in Bangalore, sir. People accept homeopathy and like all kind of practices like allopathy or Ayurveda or homeopathy. In Bangalore, the support is there. People accept it and they want to take this medicine. So many we see in our practice, like when they don't get relief from other system of medicine, at the last they come to us, like when they don't get relieved in other symptoms, so lastly they think like, okay, let me go and try homeopathy at the last. So that kind of thing goes on.
Uh, how, how many government dispensaries are there in your location or in all Bangalore?
Sir, the one is the Bangalore Homeopathic Medical College, that is government. And in Hebbal, one is there, that is a government. And in Nelmangla, there is one homeopathic dispensary, sir, government.
One man dispensary or more doctors are there in?
Sir, only one doctors are there. One
Oh.
dispensary is one doctor.
One man, okay. Then there is a very scope for homeopathy. So you will have to, your association will have to meet the minister, and they need to allow at least one dispensary in every panchayat, so that more and more homeopathic doctors will come into action. Here in Kerala, things are almost filled because most of the panchayats we have homeopathic dispensaries, either directly by government funded medical officers or NHM, national. What kind of role the NHM playing there? National homeopathy.
Yeah, National Health Mission also, yeah, it's there, sir, but they need to, like, has all the doctors are filled. So when any vacancy is there, they will give a call for homeopathic physicians.
Okay. Anyway, it's a very nice to hear all those things, because even in India, we have different set of methods in government sector. In Kerala, we have 5 homeopathic medical colleges and more than 40 hospitals, government hospitals, where we have different departments in particularly for pediatric cases, geriatric cases, gynecological cases, infertility, central psychiatric. So much of specialization is going on, and in under different names also. I think Dr. Mariama John can say something about the specialization there. She is a she has returned. She was retired from government service as DMO. That means a district medical officer. And how many? Can you explain a little bit, Dr. Mariama Jo, about the? Please, specialization.
In government service, we have Janani for infertility cases, Satkamaya for teenage Seedalem for female, pain and palliative for cancer cases, and dehydration center. Dehydration center, and also thyroid special clinics, diabetes clinics, autism clinics, and several other special clinics are there.
All these are running in a very good way, and even at every district, more than 200 infertility cases, at least successful with this government hospital. That means all Kerala, we have 14 districts, and out of which minimum there will be more than 2,000 infertility successful cases in the government sector itself. We have private doctors who are having more than 2,000 successful cases in their kitty. So many doctors having so much. So that means that homeopathy is growing here like anything, and even in a square kilometers here, you can find at least 8 to 10 homeopathic doctors sitting here, but almost all of them are having very good practice. That's the thing, that kind of achievement homeopathy has made in this area, and Kerala is seem to be the hub of homeopathy now, hope that your place also become in such way. One of my friend, Dr. Isaac Mathai, is running a very good hospital there, and he is having some free clinic for homeopathy also. Anyway, I think I invite Dr. Rambaresa to say a lot of thanks to the session.
Thank you, Dr. Shalini Madam.
Thanks.
Beautiful describe malaria and China cinchona bar. Very, very thanks behalf of IFPH. Again presentation behalf of again presentation IFPH. Very, very thanks. Thank you.
So thank you so much.
Tomorrow we will have a session from Dr. Sridhar Shah, and she will be talking about understanding Kent's psychiatry, Kent's psychology, temperament, and mental pathology of medicine. That is the subject to be discussed by Dr. Sridhar Shah tomorrow. With that, we come to the end of the day 1336. Thank you.